I graduated college from Amherst College in Massachusetts, and then I went to medical school at Johns Hopkins in Baltimore and got my medical degree there, and then stayed on to do a first-day internship and residency in internal medicine. And then I did a medical oncology fellowship and ultimately a radiation oncology residency, all at Hopkins, and finally settled in the field of radiation oncology. The first question I always ask a patient when I walk in the room after introducing myself is, I understand that Dr. I would say that, has asked you to, referred you to come see me. What's your understanding why Dr. So-and-so did that? So I try and get a good understanding, first of all, what the patient knows about their situation. So then at that point, I begin how to address, what the actual findings are, because I've already reviewed their chart and everything ahead of time. And I usually bring in pictures with me. I take snapshots of the various scans that show relevant, images, so that as we talk about what they have, what the diagnosis is, and what the staging is, and what the treatment are, pictures sometimes are really worth a lot to try and get people to visualize, what we're dealing with. So I think the first thing is that I like to listen carefully, understand where they are, at what level they understand their situation, and then educate and bring them up to a point where I think they can understand what my recommendation will be. Well, I think the main misconception I find from patients when they come here is that they think proton is like a focused beam that you can only treat like, a small tumor with. They don't understand you can actually treat the whole breast, or you can treat a large part of the lung with it. Because what we have is not just a single beam of radiation. What we have is called a scanning beam, so it actually scans across a whole area. And the nice thing about it, as the beam is scanning across, you change the energy. You can change the energy of the proton beam, and so you can vary how deep it goes in the body at each point as it's scanning across where you're treating. Kind of like a typewriter going down a page, and at each point you can vary the energy of the proton, so you can sort of paint your dose of radiation to match the anatomy that's underlying it. What changes have I seen in cancer care? Well, I've seen that there's more use of combination of chemotherapy and radiotherapy together. I've seen decreased overall toxicity to patients as treatments are being de-escalated. And proton is a way of de-escalating the side effects of radiation therapy, because it is, again, less radiation delivered to other tissues outside of that. So I see more combination of chemotherapy and radiation. I see this de-escalation, less intense, less side effects from treatment, and it's certainly much better survival. Patients are doing much better in terms of being cured, or at least very prolonged life, living with cancer. As I've thought about it, there are, I guess, three components of how I think about caring for patients. I think the first one is would be the golden rule, right? In other words, if you're going to, because there are lots of shades of gray in medicine. Not everything's black and white, and you have to make decisions at certain points of how to pursue managing a patient. And so you always say to yourself, in this point, if it was me or if it was someone in my family, how would I want to do it? It helps to guide you. The second one is to, I think the word for it is equanimity. As a physician, when a patient comes in, I'm a cancer doctor, a patient comes with a new diagnosis of cancer. As you can imagine, the patient probably is fairly anxious and a lot of concerns. And and our goal is to listen carefully, try and understand exactly what's going on with the patient, and then offer a plan for how to manage that will calm them down, and so that by the time they leave your office, they are feel more relaxed, they feel hopeful, and they see that there's a goal, there's a plan for how to manage them. And then the third thing is that I realize that any skill I have is a gift from God, and I have to use that skill for the glory of God. And that's impacted me recently, because people have asked me, gee, Dr. Meek, you're getting at a point, one can be retiring and so forth. And the staff actually had a nice birthday party for me last month, and that question came up. And I said to them, well, I've thought about this, but if God has given us all different gifts, right? And God maybe has given me a gift of how to help take care of patients. If I don't use that gift, that's not to the glory of God. That's squandering that gift. So you have to keep on using that gift. As long as God has given me the brains to do it, I will do that. So I have no plans for retirement.